Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest to the program today, I'd like to share a few thoughts with you. For those of you who watch the program regularly, you know I like to give some updates about COVID-19 and our community response. So we are all hopeful that we will be able to move forward to having restrictions lifted after the next few weeks. Meanwhile, the Public Health Unit reminds us that physical activity is important for everyone's well-being. As the weather improves, children and adults are naturally drawn to outdoor activities, including parks and playground equipment. These are wonderful ways to remain active, and their safety from potential hazards, not only from COVID-19, but also from the sun, mosquitoes, and ticks, is important. While outdoor recreation is strongly encouraged, the Public Health Unit reminds us that we must all continue to wear a mask properly, use a sun hat and sunscreen, and apply an appropriate bug repellent to help keep the family safe while outside. There is good news regarding the decline in the number of new cases of COVID-19 in Grey Bruce. The Public Health Unit could not have done this without the help of all of the community, and they need for us to continue the good work. We can all agree that we want this lockdown to be the very last one we will have to go through, and no more extensions. We are looking forward to the lifting of the restrictions, but in the meantime, please stay the course by following the 3 W's and a couple of A's as well, recommended by the Grey Bruce Health Unit. Wash your hands, watch your distance, wear a mask, avoid travel unless absolutely essential, and avoid large gatherings. This journey has been long, and we are all very weary. The sacrifices we continue to make each and every day will bring all of us closer to the finish line. Let's make this difference together. Thank you to the community for all that you're doing to support each other and to support the health unit in bringing an end to COVID-19. And on that note, I also want to thank and welcome our guest who is from the health unit, Ian Reich. Thank you so much for joining us today.
Thanks so much for having me. It's always great to be here.
Thank you. So I know that you have a new role at the health unit, or an expanded role, I think, is more appropriate. It seems like everybody keeps adding to their portfolios these days. Can you fill us in a little bit about what you do at the Public Health Unit now before we talk more specifically about COVID-19?
Absolutely. So even before COVID started, I was the harm reduction manager here at the health unit, as well as the sexual health manager. So I manage those two programs. Since COVID has been here, I've also taken on a role of COVID communications co-manager, co-lead along with Drew Ferguson here at the health unit. So I manage the team primarily that operates the website, social media. We develop media releases, all those sorts of fun things related to COVID is part of my role. But just recently, obviously, since Susan Schuler did retire from her position, congratulations for her. I've stepped in to provide interim support for the director of programs and operations until the health unit is able to recruit a full-time replacement for that role.
Excellent. So you've got a lot on your plate for sure.
Absolutely. It's always a full meal.
So we chatted briefly by email, and we kind of agreed that we just go from a variety of topics because there's just so much happening for sure. So I think, if you don't mind, let's chat about the vaccine clinics first. I volunteer at the clinics, which is just a remarkable experience, and I'm due again to volunteer this week. But I was very impressed as a volunteer to get a survey asking for my input about my experiences, and then to get the results of that survey and to feel as if we were really listened to. The Grey Bruce Health Unit, in the middle of a pandemic, trying to do a massive spread of vaccines to hit people's arms, was still working on quality improvement and listening to people. I was quite amazed and delighted, actually. Can you talk a little bit more about that and some of the things that will change as a result of this survey?
Yeah, most definitely. So one piece that's always the easiest to push away from our roles is the evaluation piece, but at the same point in time, it is perhaps the most critical piece in the work that we do is continuous evaluation. So in healthcare, we call it plan, do, study, and act. So it's basically a constant cycle of improvement. And we always want to do that. And probably the best way of collecting the information about how we're doing is directly by asking the people that are doing the tasks for us, and in particular, the volunteers. Because just like everyone else in Grey Bruce, we are tired, and we are sort of so ready to move on from this. And that is something that we have to be extremely attuned to, is how tired our volunteers are, and what can we do to improve the atmosphere of volunteering at these hubs, because they're long days. It's not a typical work environment. It's loud, it's noisy, there's lots of people moving here and there, and it's continuously busy. So we need to make sure that the volunteers have a voice to say, you know what, this works great for me, but this doesn't. And we really need to take to heart everything that every volunteer and staff members say, based on their experience at those vaccine hubs, in order to improve the experience for them. Because if we can keep the volunteers and the staff as happy as possible, we can get more people vaccinated in a faster time frame while we continue to smile. And sort of, it's a really, really exciting point in time that we are experiencing right now. And it's a once in a lifetime opportunity to be actually part of this. But it's really easy for the minor challenges that happen throughout the day at the hubs to get in the way of that enjoyment. So we really want to identify all those challenges and do everything we can realistically, to alleviate those things. One of the, I think, biggest things that came to the forefront early on in the hub process was the availability of water, just for the volunteers and the staff. So I know the team's done a lot of work to try and make sure that there's always water available at some place within the hub. Because we're also dealing with a complex environment that is considered a clinical environment. So having food and drink goes against a lot of infection control guidance and recommendations. So we have to solve these complex problems sort of on the fly. And that's what these surveys really help us to do, is to identify the concerns and to see what's realistic to fix. And if it can't be fixed, what are solutions we can develop back and forth that would make it okay for both parties to move forward, type thing.
What I really liked was the quick turnaround time from the time the input was sought to the actual feedback, and the feedback included things that had already been changed. That's remarkable. I mean, surveys don't always work like that. So it was quite encouraging, certainly, to see. And, there are smiles underneath those masks. I've decided that there is one advantage to getting older with wrinkles, because when you smile, the wrinkles around your eyes show more, so people know you're smiling, even when you're wearing a mask. So
absolutely.
Yeah, that's one thing I've learned. So certainly there's been some changes already made at the vaccine clinics. And are you pleased with the results, as far, not just from the survey, but from the flow through? I've been reading about the numbers that are going through. What would you say about what's happening there?
I think the flow through is wonderful. I know a few clinics we had in, I believe it was April, there was definitely challenges with lineups. So an example of that was our clinic here at the Bayshore that we did originally have. When it got busy, so when the full capacity of what we thought would be full capacity started to arrive at the Bayshore, it was just the setup of that clinic that really caused a bit of a bottleneck. We identified that within a week and a half period of time, and what we did was relocate it to an actual hockey ice surface at the Julie MacArthur Center, because really the hockey hub was designed using a large ice surface to really facilitate the design and the ability to move through an area very quickly. The previous design at the Bayshore was wonderful and really was great to support those more high-risk individuals where the number of people arriving at the clinics were smaller. But what we definitely became attuned to in a very short order was the fact that once we get that full capacity of the folks we need to get through, because of the multi-room design of the Bayshore that we were using, it just wasn't the most efficient method. So we reached out to the city of Owen Sound, and we developed a really quick turnaround to move the hub over to the Julian MacArthur. And ever since then, flow rate has really not been much of a concern. But also we experienced very similar issues in places like Kincardine, and at one point also there was one clinic in Hanover that did have considerable lineups. And really a lot of the issues related to that were people were just so excited to get their vaccine that they were showing up 10, 20, 30 minutes early for their appointment, and they were going to wait in line. So we enhanced the messaging to really ensure people just arrive. You know what? You don't have, it's not like another doctor's appointment. You can arrive on time. You don't have to be early or anything like that. And that really did just that simple intervention of assessing what the problem was and fixing the issue, just improving communication and signage to let people know, you know what, just stay in your car until it's your appointment time. And that by itself really did help solve the solution. Other pieces that we did identify was the challenge between our local booking system and the provincial booking system and the registration, where that intersects with registration. And that caused another bit of a bottleneck. So we came up with solutions, how we can resolve that and make it a bit more seamless for the registration folks at the hub clinic. So it doesn't cause a bottleneck type thing. So really, we try to design the system as efficiently as possible. But once you move to the real world, it's the real-time feedback that is probably the most beneficial to help solve a problem. And that's what we've been doing since the hubs have been in place. And really, they're operating extremely smooth. I'm just amazed at how many people we can get in such a short period of time, especially being up in a rural area. Hats off to the entire planning team, but also the public for, growing with us through these little bit of challenges, but then following through, showing up for your appointments, going through and providing that feedback, because not just the volunteers, we're also asking for significant feedback from everyone that gets their vaccine. You'll notice once you get your vaccine in these hubs, there's an actual poster asking for your feedback. So you can take your cell phone, scan the QR code that's right in front of you, and it brings you directly to the survey. And that survey feeds our quality improvement over time. So really, really critical to get that real-time info from everyone that's involved.
And that is true. I mean, even the basics like color-coded name tags now to identify who's who, because PPE is universal, right? I mean, and it just something like that makes all the difference if you're a volunteer and you need to know who to ask, other than the person with the needle.
Yeah.
Yeah, it just helps with that identification. So certainly, I know that the statistics as far as how many are being vaccinated and what period of time is a measure of success, but I truly think that the fact that feedback in the survey is another measure of success, because the process changes as a result. And I think, like you say, sometimes we don't think of that as a measure, but it's an important one for sure.
Absolutely.
So as we move forward, and I know it's hard to have a crystal ball, but I'm asking for one anyway. How long do you think we're going to need the hubs to continue? If all works out, where's the hope that the hub won't be necessary for vaccines? Are we looking into the fall?
Yeah, I think a very safe estimate would be September. I really do think that's a safe estimate. And the reason I'm using that as a date is right now we are still at the 16-week interval for second doses of vaccine for the majority of individuals. So we have to add, we know that as the last person gets their first dose, we have to add 16 weeks to that to assume that's when the last large-scale hub is going to be required to give the second dose for that last group of individuals.
Right.
So I think it's a safe assessment to look at September as one of those dates. But then we also look at things like how the youth are going to be vaccinated. And they're actually a group that's going to have a shorter interval, because the goal is to get them all vaccinated, or whoever eligible and wanting the vaccine to be able to get them vaccinated prior to going back to school. So they'll be getting their first shots over the next week or two. We add 8 to 12 weeks to that, and we'll be able to complete them prior to August. So, or by August, sorry. So all that adds up to looking like September is probably going to be the end of the large mass scale vaccines. And we'll be looking at more partnering with primary care, using the COVID vaccine very similarly to how we use other vaccines. The distribution would be similar, that sort of thing. And when we look at the change of conditions required to store these vaccines that's recently come through, for instance, Pfizer can now be stored for up to a month in refrigerated temperatures, whereas before it was they had to have a super deep cold freezer up to -80 to store for long periods of time. So that change in and of itself will allow our primary care providers to store their vaccine for a month as opposed to just for 5 hours or for a week per se.
Right.
So it really does open a lot more doors, but definitely the focus is still on the mass clinics to get as many people vaccinated as quickly as possible based on dose allocation. And we're also doing focus clinics for high-risk healthcare workers, going to them as opposed to having them take time off work to come to a hub or something like that. So we're doing that this week, and next week we're actually going to have a large hub clinic for second dose for healthcare workers as well that meet the criteria. There's a specific list of who's eligible. So anyone eligible, they've received direct communication from us on how to book, when to book, that sort of thing. So really excited moving forward to make sure we capture all these smaller segment groups that fall outside of a hub model.
Excellent. So certainly we're all hopeful that the supply of vaccines continues and that we're able to move forward. So planning through the summer will be a staffing and volunteer requirement of the public health unit, correct?
Absolutely. We're just entering talks on, how are we going to get back to normal? And two big questions that really tell us that is, one, how many cases of COVID are we managing? And then two, how many people have we vaccinated? How many staff do we need to accommodate what we're trying to do? Knowing those two answers, let us know how many staff and volunteers are needed to support those two big buckets of work. And that will allow us to then say, okay, we can shift a few staff back to what they were doing, prioritize the most important things that have occurred since the inception of COVID, and really focus on those highest priority programs and get those up to a level of operation first. As we move through all the other programs and as the vaccines end and the COVID case management ends, staff will then shift back to their previous programs, and all programs eventually will be up and running. And I don't want to say exactly how they used to be, because it's times like this with a lot of stress and change that are sometimes the best times to say, you know what, let's relook at how we were doing things, and can we improve on how we were doing it and design perhaps something that looks different and works better and has better interaction with their community partners, better interaction with their clients, is more equitable. All these are great questions to look at when we are starting back into what we previously were doing after a big event like this. It's perfect timing, and we're looking forward to going into it.
Certainly, we always think of timeframes, the next 16 weeks or June 2nd. or I have that etched in my brain as the first smell of freedom. I'm hopeful, but really we may be several years evaluating and modifying delivery of programs, especially in healthcare, and the health unit obviously will be helping to do that, I'm sure, not just for themselves but for others as well. So I wanted to chat a little bit about the topic of the opioid crisis, because it is linked, of course, to what's happening and the COVID restrictions. Where are we in status now? I know we've chatted before, but we're still having significant events occur.
Yes, we definitely are. So we did recently get preliminary totals for the year 2020 in terms of people that have passed away related to an opioid overdose. And I don't like just throwing numbers out there, but I will say 23 families lost a loved one in 2020 due to an opioid overdose. And to date, we know anecdotally in 2021, 10 more families have lost a loved one to an opioid overdose. And that's not to say that the efforts are not there. I'm amazingly proud of the harm reduction team here at the health unit that are doing everything we can to address and keep people alive as long as possible. But perhaps the best tool for that is naloxone and dispensing naloxone. And we know that's working. We hear from our clients that they use it to reverse an overdose. So naloxone is working. However, what we have to look at is the fact that substance use, from alcohol to cannabis to illicit drugs, and that does include opioids, has been on the rise since COVID, and the COVID precautions have been in place. So we look at things like isolation, telling people to be alone. Some places saw a closure of shelters early on in the pandemic. They saw a closure of face-to-face mental health counseling, that sort of thing. Luckily here in Grey Bruce, the places like Safe and Sound have really kept things rolling and kept things going. Like, my heart goes out to what they do there. But that doesn't preclude the fact that more people are using. And if more people are using, statistics prove it. More people use, more people will unfortunately suffer an overdose. So what we need to continue to do is ensure naloxone gets into everyone's hands. But one big shift that our program is going to be doing in the recovery, so post-COVID, is looking at things more upstream. So we know that a lot of substance use and addiction is a result of historical trauma or mental health that has happened previous on in life. People use substances to numb pain, not just physical pain, but also mental pain, right? So one of our focuses is going to be working with our system partners on a framework that can help ensure that we have that early identification of those traumatic events and have a solution in place so that people don't go from childhood without resolving their issues all the way up to adolescence and adulthood and still have that issue unresolved. Our goal is really, how can we resolve these issues early on so they don't develop into a substance use disorder later on in life? Other things that we'll be looking at are advocating for things like safe supply. We're going to be continue to advocate for things like a safe consumption area here in Grey Bruce. So we look at multiple facets. How can we prevent people from developing substance use disorders? But then we also have to acknowledge that there are a large segment of people that do have substance use disorders, and how can we ensure that they stay as safe as possible? And that's through things like naloxone, through easy and immediate access to mental health services, to access to safe supplies to use drugs so they don't develop things like HIV and hepatitis C. Really, it's taking that whole human approach and along the life cycle, not just for one segment and not just here. Because our strategies, harm reduction in and of itself, the strategies are almost a Band-Aid. They're what tools can we use to keep people alive now while we work towards changing the system for the next generation so that we don't continue the cycle over and over again. So that's really going to be the work over the next couple of years here in the harm reduction program, is integrating more of the prevention aspect of things along with enhancing our harm reduction services. And part of that enhancement is working with our peers. So a peer support group that would be able to go out to the community and work alongside people that are still struggling with addiction and mental health, give them advice, but also dispense naloxone, give them harm reduction supplies, as well as open doors to mental health and addiction agencies so that the individuals, when they're ready, can access that help. So lots of great work that's going to be coming post-COVID. I'm really looking forward to it because the epidemic is not going anywhere. It's really gone hand in hand with COVID, but the opioid epidemic is still alive here in Grey Bruce.
For sure. It sounds like an opportunity to create something out of the COVID situation that will ultimately be of benefit to a large population, and to link, again, even further community together. Just in the few minutes we have left, one of the things that occurred to me when we talk about families losing loved ones, for sure, But there's another group of people that are having, seeing someone overdose or expire, unfortunately, on the street, are those people who are walking by or the bystanders. And that's a concern too, because that's not always a group we think about. But, even if you're in a vehicle and you see an episode of urgent and emergent care being given to someone, that has an impact for people that gets carried. Any services available for those who happen to have that kind of experience that you're aware of?
I think perhaps the best organization to reach out to here in Grey Bruce would be Victim Services in Grey Bruce. They have absolutely wonderful services available to people that do experience something that they feel is traumatic to themselves. And that's a really important point when we're talking about a traumatic event. A traumatic event isn't necessarily on a scale. Just because for me something seems fairly small, for someone else it could be significant, and significant enough to cause symptoms of things like PTSD or actually a traumatic event. So we have to look at that and realize that trauma is completely dependent on the individual. Trauma isn't dependent on how big the situation was. It doesn't have to be a 9/11 event to cause trauma in an individual. It could be as simple as being scolded in an inappropriate way in the workplace that traumatizes someone to the level of them feeling symptoms of PTSD or similar, So trauma is very much dependent on the person, not the event itself. So Victim Services is wonderful to reach out to.
For sure. And I think that we're all in this together. We're all here to support the community and to support those. I mean, this is it impacts everyone, and certainly knowing there's services available for everyone is helpful. As always, it's a pleasure to speak to you, Ian. I really appreciate you taking the time, and I look forward to speaking to you again about even more positive things as we move forward to the recovery phase post-COVID. You take care and stay safe.
Absolutely. You stay safe and everyone stay safe.
Thank you. And thank you to our viewing audience for joining us today. Please join us again to learn more about programs and services available to you and your family. Take care, stay safe, care for each other. Thank you.